Afternoon, everyone. You have joined the PNQIN Monthly Equity Bundle webinar. We're super excited for our presentation today, and we'll just give it a minute or so as people continue to join. I'll just go really quickly through our usual housekeeping items. Please type your name and institution into the chat for attendance purposes. An optional share for this month. March is Women's History Month, so we'd love to hear about any unsung women heroines in history or your personal life who are meaningful to you. I'll just say quickly that the PNQIN team is majority women, very amazing, incredible women who are so dedicated to PNQIN's mission and vision. And so I just want to acknowledge all of my wonderful coworkers and PNQIN leaders. As usual, please mute yourselves when you're not speaking. Feel free to type any questions you may have for the PNQIN team or our presenters from Martha's Vineyard into the chat, and we'll address them at the end of their presentation. And as always, we'll record this session and upload the slides to our website afterwards for anyone who's not able to be here. All right, we've got a full house today. This is great. I hear the Martha's Vineyard team has been doing a lot of advertising. So welcome, everybody. All right. If you're just joining, please put your name and institution into the chat for attendance, and feel free to share an unsung heroine in history or your personal life as we celebrate Women's History Month in March. As people continue to join, since we have a lot here, I'm going to go ahead and go through our agenda and some PNQIN announcements, and then also speak about data for a little bit before I turn it over to our team presentation for today. So as always, we acknowledge the PNQIN team and the PNQIN Maternal Equity Bundle work group who have worked with us for almost 2 years now to refine this bundle, put on these webinars, and have given us feedback and support along the way. And we also thank you, our hospital teams, over half of you from the state, as represented here on the map, have been joining these webinars for over a year and implementing all the components of this bundle. And so we thank you for joining us in this important work. Okay, so a few announcements. We're coming up on our final few webinars for this equity bundle. Today we have Martha's Vineyard presenting, and then we're so looking forward to presentations from Mount Auburn, Lowell General, and Tufts this spring and summer. So be sure to join us for those. After the equity bundle concludes this year in June, we're excited to turn our sights on the perinatal mental health conditions bundle with an equity lens, of course, which will be launching this fall with leadership from Tiffany Moore-Simus at UMass Memorial Medical Center, who helped write the bundle. So we're going right to the source with this one. We're very lucky to have her. We have an announcement from the Mother's Milk Bank Northeast. The Act to Improve Access to Breast Pumps has reported favorably out of the Financial Services Committee in Massachusetts and has been now assigned to the Healthcare Financing Committee. And so the neonatal side of PNQIN is asking for everyone's support on this bill by writing an email or a letter to respond to a call to action. So you can learn more about what this bill is about and what exactly you can do to help support by clicking the links in the chat that Caroline is putting in, or using the QR codes to access their web pages and their petition. We also are extending the invitation for a baby-friendly study that's happening out of Boston Medical Center. Their study team would like to hear from staff and supervisors at baby-friendly hospitals about their experiences and recommendations with that recognition and those projects. So if you are part of a baby-friendly hospital, you can take this brief 5-minute survey to determine your eligibility for the study. And then the study's team will reach out to you to schedule an interview. And compensation is a $50 gift card. So our partners at the Institute for Perinatal Quality Improvement have a webinar coming up in April around severe hypertension. It's called Lessons Learned from a Statewide Learning Collaborative to Improve Hypertension Recognition and Response. So those of you who implemented the hypertension bundle with PNQIN or are continuing to implement, this would be of particular interest. PQI team always brings together a great group of speakers, so hope you're able to make it to that one. A couple announcements from our friends over at March of Dimes. Their March for Change event is coming up next Friday, March 28th. This is an advocacy event where you have the opportunity to meet with Mass lawmakers and advocate for topics and other things that are important to you. So you can register and learn more. And this event is in person, starting at the Omni Parker House Hotel and then going over to the State House. And then March of Dimes annual March for Babies is on May 11th on the Esplanade in Boston. They have several great events listed out here on this agenda. And I believe it's the Massachusetts AWAN has a team that you can join and march with. So if Karen or Mimi are on the call and would like to share the information to join their team, please go ahead and do so. Speak Up events, we have a couple coming up this year. There's a Speak Up Ambassador training. So this is the next step after Speak Up Champions training. The ambassador training just allows you to continue outlining strategies for helping individuals and groups at your institution dismantle racism, provide quality, equitable care, and reduce disparities. This is a one-day training for 6 hours, and CNE credits are available. It's on May 17th. And then if you're interested in taking your Speak Up education a step further, you can become Speak Up faculty, which trains you to deliver Speak Up trainings at your own institution. So this is a great opportunity. If you must be a Speak Up champion and ambassador to be eligible to become faculty. So if you are interested in taking the ambassador training and going on to faculty training, you can start your application prior to the ambassador training on May 17th so that you have enough time to complete your application by June 1st. And if you have any questions about that, feel free to reach out to me. Lastly, PNQIN, Caroline has been instrumental in helping build out our new PNQIN resource library on our website. We have several resources for quality improvement, for the maternal equity bundle, as well as all of our past projects on the website. So feel free to check those out if you are in need of support or guidance around any of our bundles. Okay. Before I turn it over to the Martha's Vineyard team, I just want to share a couple updates on our aggregate data for the equity bundle. So the slide here you can see shows our data for the equity bundle for structure measure 1, equity team based in obstetrics or reproductive health. So we're doing really great on this, which is amazing. But what we wanted to point out with this slide is that we are receiving far fewer submissions this year as we were compared to this time last year. So February 2023, we had 16 submissions. And for February 2024, we only had 6. So we just wanted to take this opportunity to keep encouraging you all to submit your data. It's really, really helpful for us to paint a more accurate picture of the progress we're making with this bundle. And it's further demonstrated in the data on this slide, one of our process measures around provider education. You can see we were doing really, really well last February and up to the last fall, where we were seeing the numbers start to climb. But then as we've seen a drop off in data submissions, now we're kind of down to these lower levels, which we know isn't accurate, but we don't know for sure unless everyone continues to submit data. So this is just our way of saying we have about 4 months left of this bundle before we switch gears to mental health. And so we really want to help you all finish as strongly as possible. Please continue to submit your monthly data. And I also just want to open up the opportunity in the chat to let us know if there are any challenges or hurdles you're experiencing as of late that are making data submission a bit more difficult. We really would love to know so that we can help support you better. So if there's anything going on with data submission, please feel free to put it in the chat, or you can message Caroline or I privately, and we'll follow up with you after the webinar. So thank you all so much. We know data submission can be difficult, especially with competing priorities, but it really, really is helpful. And with that, it is my pleasure to turn it over to the Martha's Vineyard team to share with us about their Respectful Care project.
Hi, everyone. I'm Sandra Ciciora. I'm one of the nurses at Martha's Vineyard Hospital in the maternity unit. And thank you all for letting us present today our Respectful Maternity Care project that we have created. Dr. Pesch and I will be presenting it to you. So Kaylee, if you want to advance the slide, that would be great. So as I said, my name's Sandy, and Dr. Pesch will be presenting with me, and we have about 11 other people that are actually involved with our committee that was created to get the project going and to have it be where we are today. So thanks for letting us present.
Yeah, I appreciate that. Just also wanted to say I've been practicing on the island for about 14 years, and before that, I was a seasonal resident for my entire life. And I think, the reflection I would have is that this project has really focused an awful lot of my learning into a very short time frame in the last year. And so we're really happy to share kind of our journey with all this. So thank you for having us.
So as far as our agenda, just going to go over it briefly. We're going to give you some information about Martha's Vineyard Hospital and our maternity unit at a glance, and how we became involved with starting our Respectful Maternity project, the objectives and overview, how we got into our journey and the key project milestones, and how far we've come with our outcomes and where we hope to go next. And then hopefully there'll be some time for some questions and answers if needed.
All right. Slide. Jump to that next slide, and yeah. I think we can go one more. So the island of Martha's Vineyard, we have about 21,000 people who are the year-round residents. But in the summertime, we do jump to about 120,000 folks. Despite that, our obstetric care remains relatively stable through the time frame. We do have some people who do come to the island for prenatal care during the summers. During COVID, we had a lot more people coming as kind of a destination delivery site, which represented some challenges. But in 2023, we did about 114 live births, and that varies anywhere from that 114 up to 140. Depending upon kind of the island population and how things are going. We're a 25-bed critical access hospital. 5 of those beds are maternity beds. And as we reflected on the other slide, there have been a lot of people that have helped out with this, and they've come and gone through the project, but they've all been involved, and I think lots of them are on the call today. But Claire Seguin, our chief nurse, has really been supportive through the whole project. And probably most importantly, Joyce Capobianco, who's our nurse director of maternity, did a tremendous amount of work and really should be making the presentation today. So I'm just a stand-in for Joyce, but we always say on the unit, it's WWJD, what would Joyce do? And so that's the way, we look at things. We're a small team, and Estelle helped us out. She's moved on to a different hospital, but is still helping us out with the quality. Obviously, Sandy. Our nurse midwives, Nancy Laporte and Susie Zimmerman, have been really, key, obviously. And then Dr. Stewart, who's the other obstetrician on the island. But the support staff of, Alicia in the office, Amy, and kind of reaching out to the community. And then Rachel Vargas, who really helped us with a lot of the cultural pieces that led to us crafting our project, as it were. And Devani Wright has been all along our our support on the IT piece and making sure things go right. I think one of the early things that informed on the project was, and we'll get into a little bit of the statistics here, but we had kind of an implicit bias about the community on the island and about what what was going to work and what wasn't going to work. And it was interesting. We had Rachel organize a seminar with two physicians from our system who come from Brazil, and they gave us this presentation. And we'd known that our Brazilian population here on the island really did favor cesarean delivery as a route of delivery. And it really wasn't until we had this seminar not that long ago that was brought to our attention that in Brazil, there's a law that actually allows patients at 39 weeks to declare, how they'd like to deliver. They can choose to have a cesarean delivery. And while the Brazilian government has done a tremendous amount of work on equitable prenatal care, in fact, everybody gets a prenatal pamphlet. It really is about everybody being on the same playing field, that, there are no, everybody gets the same access to care, and they really support that equitable prenatal care. One of the components of it is offering cesarean delivery, or at least making it a legal offering, near term. And interestingly, here we struggle a little bit with the idea that patients would come in and say, okay, well, I want my cesarean delivery. And during this project, we've worked and learned an awful lot about how we address the kind of this national norm, if you will. So it's been a good learning project on that front. So I think we can go to the next slide. The other piece that we learned is that while here on the island, we can see, the population broken down by race, and 70% identify as white. And then the group that makes up the Hispanic group is a much smaller proportion than we would have expected. And what really it comes down to is that the Brazilian population is also, like our country, very eclectic. And so if you look at ethnicity, you'll see it breaks out differently. Again, those that identify as Brazilian in that light blue, it's a different percentage. It's certainly not 18%. And it rises to 37%. And then there are folks from Brazil identify as European. We do have the Wampanoag on the island and identify as Native American. And then we have Caribbean Islanders, and you can see that Portuguese makes up another proportion of the group. So what we settled on is that preferred language seems to be a better representation of how we can look at some of the data. That obviously we have 78% English speakers, but the preferred language of Portuguese at 22%. It was, a better way for us to take a look at how we were caring for the population. So again, I think, as we looked through this and tried to figure out how best to approach, maternal equity, we did have to look at just how, the demographics broke out and how best to try to characterize some of our data. So we'll move on to the next slide, and I'll let Sandy get through the rest of them.
You can actually jump to the next one too, if you don't mind, Kaylee. Thank you. So we developed our care objectives once we recognized the need for improvement and our goals. And the first thing we were trying to do was improve the diverse patient experience, both in the inpatient maternity unit and the office where we provide our prenatal care, and the OBGYN office. Related to courtesy and respect. We were hoping to increase it by 1% at the end of the calendar year to 2023. And also keep the mortality rate at 0, and to try and reduce the C-section rate in our diverse patient population. Next slide. So we then developed care concepts and a commitment to the project and to our patients to respect every patient, every interaction, every time. And in addition to that, we actually created a anti-racism statement, which is on the side here of this poster, that reflects us. Actually, I was going to read it, but I'm getting cut off by all the people here. So you can look at it if you'd like, but it's just reflecting our anti-racism statement that we will provide equal care for all, and the best that we can do, dismantling any barriers in the system. And then we realized that not only did we need to involve and educate our staff, but that we needed to find a way that we could actually educate and make the patients aware of what respectful maternity care was and how we could build a partnership with them. So we created a pamphlet that is now given out into the prenatal packets very early on in the office. And we included a lot of the information about respectful maternity care and how patients could become involved in talking to us and letting us know their choices, past experiences that may have reflected, patients getting care, whether they be good experiences or bad experiences. We are encouraging them to be advocates for themselves and making shared decision choices, and asking questions and being involved with informed consent. And we are advocating for them to speak up, that we will listen, their voices matter. And then if they do feel as though they're experiencing any disrespectful care or concerns, that they have the courage to speak up to us. And if they don't, we have created, which you'll see later in another slide, on the posters, a way that they can anonymously call if they feel as though they've had a problem while they've been here. And then in return, we as a group will provide them with privacy. We'll treat them with dignity and respect. We will be accountable for the commitment that we made to them. And we will educate our staff so that we can stand up for them, advocate them, and provide them with evidence-based care and making choices and respect their birth plans. Next slide, Kaylee, please. So, and you can go to the next one. Dan, if you want to take over for that.
Okay. Yeah, Sandy not wanting to do any of the data slides. So what we did for our baseline experience data is we looked at our NRC patient experience. It's what we use for our patient satisfaction data in the system. And we did update the questions slightly just to make sure we were capturing the spirit of what we were doing. But our baseline data in the calendar year 2022, you can see we actually do pretty well. I mean, we were benchmarking against less than 100 bed hospitals, we do quite well, for the providers, the nurses, and our reception staff, as compared to our national cohort. But basically, when we stratify them by the social demographics, there are less favorable responses received from patients of color and non-English speaking respondents. We were like, this is Martha's Vineyard. We treat everybody the same, and it's clearly not the case. You'll see later we have a little bit more breakout of the data, but we did notice a significant difference in the experience of patients of color and non-English speaking respondents. That again was the driver for this project. I think we can move on to the next.
So we developed training initiatives for the staff, and we were looking to not only increase the awareness of the need for respectful care, but also needing to explain to them that and educate them about respectful care. And the one thing that I felt when I got involved was I really felt like we did a really good job here with our respect for our patients and their choices. And but the more I delved into getting myself educated about it, I realized that it's not only just learning about it, and it's not something that you can sort of take a test and pass the test and then just move on, that it's actually more than that. And it's adapting a culture of all of us kind of acting together at the same time and being respectful of one another, but also in how we care for our patients. So increasing the awareness and educating the staff, addressing racial and social inequities that affect birthing in the United States, including all underrepresented populations. And this was, first of all, I had no clue as to where to start with this. And I developed a PowerPoint presentation that is now in all of our staff's health stream, which is our online education for our trainings. And anybody who experiences any connection with prenatal or pregnancy patients will be have this included in their education to accomplish. And one of the big things that I think I realized was that it's not only people of color that this whole equity affects, it's the whole list I included of underrepresented populations, and some of, substance abuse and adolescents, people, obesity, non-English speaking, as we're experiencing with this. So it was an education for me as to how many other populations there truly are that are affected by equity and diversity. And then to promote accountability, encouraging reflection for our own personal growth. And as an organization, just getting it hospital-wide. We did at one point in our MD Things to Know, we put out there that we were doing this so that even people in other departments would start to think about respectful care, not just in maternity. And then lastly, ensuring that birthing women have safe, optimal, and supportive care throughout their pregnancy, labor and birth, and postpartum experiences. Next slide. And once we developed it, as far as patient considerations and the staff, part of the training that I did do was we actually didn't make them take it, but we asked, on paper, but we did ask them to do this self-evaluation assessment of one's biases that we included in the training. And that was because, we don't all even begin to understand until you get into this, how our own physical, emotional, and verbal behavior affects people. And so just trying to recognize our own biases that we have and dealing with them first, and then gaining the staff's commitment to deliver the respectful maternity care. And one of my biggest things was I met with our staff in the maternity unit and wanted to educate them a little bit before they get into the training, to just make sure that everybody understood that this was not that we were doing bad. that we were actually doing fairly good, but that we could do a lot better, and wanted them to have a positive attitude about it. So that was done. And then defining pathways to develop and identify how we would confront disrespectful behavior, that not that it's any different in a big institution, but with such a small staff, we are all very close. And it's hard to, when you pick up on something that you feel is disrespectful, confront each other at the time, which is best. But just finding how we were going to have courageous conversations with each other. So we did include that. So our training started in, we started the project in January, and we got our training out to the staff in maternity in the offices, the OB/GYN office, by June. And we gave them 2 months to complete it, and everybody completed it. And then we also realized that we needed to get it across to our operating room staff and the perioperative services and our anesthesia department, because we do our cesareans in the operating room. So that is something that we accomplished next, and we developed that for another 2 months. And then we also gave it out to some of our ancillary services that are involved with perinatal patients, and especially our pediatric and newborn providers, the family practice people, and also the pediatricians. So that pretty much was our training. I did include in the PowerPoint, I found the A1 toolkit for respectful maternity care very helpful in creating the PowerPoint. And also in that, they have some really great videos of personal experiences that patients have had that really represent disrespectful care. And I did include on some of the slides the link so that people could go in and watch those. And I think it helps to really sum up the whole thing. So the training's gone, I think, pretty successful. Everybody has done it. And for future staff that come on board, they'll be required to do it also. And then in recognizing our Portuguese patients, we actually have identified a lot of ways that we can help to have more equitable care for them. We have instituted using the either language line services on the telephones, or we now have the iPads that you can actually do the video services, which I find is sometimes very helpful when you're trying to demonstrate things, or it makes it on a more personal level. In our OB/GYN office for the prenatal care, our midwives and the staff have been able to get an in-person translator, which is very helpful. I think that they have felt that that's much more fluent visits with a lot more interaction than just a yes, no answer. We have created a weekly group for it's a bi-weekly group in the last 2 months of the prenatal care, which the midwives have recognized a great need for. And just starting last week, that they will have group prenatal visits for our Portuguese patients. And it's also gonna help increase the peer support, because in the past, our families have had a great support system here, usually with very extended families and lots of people coming to visit and being supportive and helpful. And the community has the churches out there in their groups. But ever since COVID, it seems like it has changed some. And our midwives have recognized that there are quite a few more women here that are on the island that don't have anybody. They just have their other spouse now. So increasing the peer support and getting people to know each other. They do their weekly visit, and they're also getting some education. And we have improved the use of our interpretation services all around, and anything that we are handing out education-wise, we're trying to incorporate in English in a grade appropriate level, which we realized that we were maybe had the grade level too high. And all of our posters and everything that we have here in the departments or we hand out are in Portuguese and English. We're also trying to increase our perinatal support for losses with our Portuguese patients. And we have online right now childbirth education program. It's called Yomingo, that they can actually access for all of their care and education. Next slide, Kaylee, please. These are some of the things that we have created in addition to the training and education. This up in the left-hand corner is the brochure that they're handing out in the office, which we find is, I think, very helpful, because right from the start, the patients are aware of that. We also created down in the bottom right-hand corner, this is one of our posters that is a lot like we just went through with the objectives for care concepts. But in the bottom right-hand corner is where there is the phone number for them if they feel like they need to speak to somebody and they haven't been able to conquer that during their stay in the hospital. So those posters are in the patient's rooms, and they're in English and Portuguese. And on our doors coming into the maternity unit, it's got the same sort of communication with the concepts of it and how they can support our commitment to them and all of that. And it is also in the waiting rooms downstairs in the OBGYN office. Up in the top right-hand corner is our commitment to respectful maternity care that is on the unit. If you see Joyce and I in the picture, that is in our nursing station where we hold our huddles, and it not only has the core concepts and our commitment to the patients, but on the bottom right-hand corner is the commitment form that we all abide by. We also created, I was able to find through A1 store, we have our respectful maternity care buttons that we purchased, which are great. It's the care concepts, all 7 of them. And we realized after we got them that how can we wear these and not have them in Portuguese? So Rachel Vargas was helpful, very helpful in getting them all created in Portuguese too. So we have lots of buttons here for everybody to wear. So those are some of the things that we created to try to communicate to everybody around us, that patients, staff, everybody. Next slide, please, Kaylee. And this is just a response from one of our patients that we thought was pretty good to reflect where we've come and what we've done. But your patient's empathy, enthusiasm, encouragement, and the way you listened helped and explained during such a vulnerable and much anticipated time. We could not have been more grateful. So we're hoping that our patients will continue to do the NRC responses for us to figure out how well we're doing. Next slide. This is our project timeline that you can look over, but it just reflects that we started in January of 2023. We created our teams, we got everything together. We started the education by June of 2023, and that went through September. And then just ongoing, seeing how things are going. And we're looking at we did a 6-month reflection on how we're doing, and we'll do another 12-month. And we also actually have encouraging our patients. We have Portuguese and English ones that we give out on admission that we're hoping that they will encourage them to do the NRC survey so we can have accurate statistics. And if you could go to the next slide, please.
All right, so now we're just going to move to the outcomes, and we can go to the next slide. So somebody asked in the chat, just, we have a significant Brazilian population that speaks Portuguese, and it's probably worth talking a little bit about that here, that initially we had language line that translated to Portuguese. And now we basically most of our speed dial and or the iPads key to Brazilian Portuguese. There's a big difference. And the fact is that if occasionally we get assigned the wrong interpreter, now I have patients who say, it's not right. Let's do this again. And the language line sometimes gets it wrong, and they're not speaking Brazilian Portuguese, but patients tell us that, and they say, let's get somebody else. I've never had that when we first started using the language line. So it's a big thing. the outcomes here, if you look at our baseline data, you can see that, again, it kind of reflects on the English speakers and then other languages. And you can see that there was a significant difference between the experience of the patients in our population. So again, NRC patient experience data, courtesy and respect stratified by preferred language, English versus all other languages. And so we have interim data that just showed that we did have improvement, but you'll see that because of the work that we did and how we were treating everyone, that we narrowed that gap basically to a non-significant difference, but everybody's experience got better. We got better at talking to all of our patients, and you can just see that it made a big difference. And I think reflecting back on what Sandy was talking about, when we started, we were like, oh, well, we'll just talk to it's going to be our maternity group and the pediatricians, and we'll be fine. But we had touches for all of our patients in radiology when they had a loss. And in other areas like the laboratory, there's nothing worse than somebody coming in, they don't speak the language, and they're saying congratulations when their quantitative HCGs are dropping. The idea that those tough conversations of you didn't use the language line when it was that's what we want you to do, and you made a misstep. And we, again, to Sandy's point, we had to correct it at the time. These are some of the painful things that we did in the work here, but everybody realized the importance of this, especially as we saw the responses of the patients, the input, the interactions got so much better, and it is reflected in this data, which happened fairly quickly. And I think most of it is word of mouth. I think that everybody, started realizing everybody's paying attention here. Everybody's, really on our team and on our side. So, and it was because everybody had buy-in. I think the other thing I would reflect on in this slide is that, again, we're kind of back to, we're a very small hospital. We don't have the production pressure that other hospitals may have, being a small place, but we also don't have as many people. But when we got everybody on the same page and every interaction made a difference for every patient, that trust was built. And so I think labor experiences, for our patients have just gotten so much better. I can tell you, people do stop and say, I don't get that. You need to explain this to me. And I can honestly say in a short time frame that this is a huge change. Back to those yes/no answers rather than an interactive process. So, again, getting the whole team involved was probably the most important thing, that every touch made a difference. So when they get to labor, they trust and they know that everybody's involved. All right, so next slide. So as a corollary, what we also wanted to look at was our cesarean delivery rates. And you can see that, C-section rates in 2022, there's a significant difference. Well, it's not, Claire will jump on me because it's not statistically significant, but the fact is there is a big difference between our English-speaking patients and the other languages for cesarean delivery rate. And while we have not had a statistically significant change, you can see that we've narrowed the gap. And I think a lot of it is the fact that we are having conversations with patients on their own terms. I was talking to Rachel this morning, and my take is that our conversations before, we really didn't understand why people wanted to have a cesarean delivery. And I think that because in Brazil, there's an issue with access and that kind of thing. At 39 weeks, people are saying, oh, well, I need to schedule my cesarean. I'm going to be on this date and we're going to do that. And our conversations now are more around, well, you could pick a date. It doesn't have to be a cesarean delivery, and that we have anesthesiologists that are always available and that you don't have to wait for that. And, you can make that choice in labor, but, you can make it at a later date, that you do have choices in the care. And those conversations are ongoing, but we are seeing that there's a change where everybody's getting that same care. And, we're seeing improvement in these numbers. Again, not statistically significant, but I think the understanding is better in the community. So, again, excellent progress. More to do always, but it is pretty remarkable. So I think we're on to next steps. Next slide.
You can advance to. So we will continue to aim to continuously improve all patient experiences and outcomes. And we strive to find new ways to be innovative in the way that we deliver maternity care here, and continue to actually work on this project and our other projects that we have created for like hypertension, management of hypertension, and also postpartum hemorrhage. We instituted huge policies and procedural stuff with that we made great headway with, and doing QBL, and most recently our operating room also starting to do QBL. And then we hope that we're going to start to prepare for the pathway to introduce team birth here, which I feel like the little bit that I do know about team birth now, and the other presentations I've seen, that I think we're really in a good place to have a good headway in being here. And the only one of the things I know that we don't do yet is the communication boards, the whiteboards in the rooms, but most of us do huddle with our physicians and midwives, and they're very good about explaining things and just being more communicative to the patients at that time that they're involved in the process. So that's where we're sort of headed. And next slide. So if you guys have any questions, I know there was a couple. I did see one down there that asked if we had in-person interpreters with our childbirth classes or our visits. And right now we do. I have to tell you that prior to COVID, I did teach the Portuguese childbirth classes with our patients with an interpreter. And I really feel like we had great success in their outcomes and what they came into labor with, knowing about the whole process. And then COVID hit and we had to create something that we could communicate all of this. I put together a paper packet with lists of videos and got them to the patients either in prenatal care or mailed them to them. But even Dr. Pesch way back then, I remember him saying to me, but some of these people can't read. So that wasn't real effective. Then we found Yomingo and we started our online education, which a lot of people register for, but they just don't seem to follow through to navigate the system to get the same effect. And now that the midwives are doing these in-person visits with the whole group, there is the same interpreter at the class, the little class that they're going to hold, as they do with the people that when they have their visits in the office early on. So I think, Kaylee, if other people have questions.
Yeah, thank you. Thank you so much. You're getting some great feedback in the chat, and I'll just invite everyone, again, if you have any questions, feel free to put them in the chat, or at this time you can use the raise hand feature on Zoom. And I'm going to turn it over to Dr. Kristen Price from PNQIN to help facilitate our last 10 or so minutes of discussion.
Thank you, Kaylee. I'm standing in for Audra, who is traveling at the moment. Ron Iverson did put a comment in the chat. He's interested to hear how you would modify the team birth product and process specifically to your community.
So how we would get the team birth approach into our staffing? Is that the question?
Well, how we would modify it, I guess, is the question. I think we're in the process of working on that. But.
Yeah.
I wouldn't expect an answer now, but it'll be interesting to hear what your team comes up with as you think about it, how it applies to your team, your patient.
I have done a little bit of research into the process, and I guess through Adriana Labs, you can actually get into their process. And that was going to be my next step to get more information about where we need to go from here.
This is Bonnie. That'll be a good next step. Logical.
Thank you.
Congratulations for figuring that out.
Yeah, they seem to be, it looks like a great program, and from people's responses that it was really helpful. Just like the A1 and other things that I found.
I think you'll find really good support and colleagueship, and you'll have contributions that are important to make to others.
Great. Thank you.
And Sandy, also let us know at PNQIN, we can also help connect you to other teams who have implemented team birth. So happy, I'm sure people will be happy to share materials or lessons learned. So happy to facilitate that too.
Okay, thank you. Also, I didn't include any of the PowerPoint, but if anybody has any questions about that or needed to see anything in it, that's available too, that we can arrange.
I think all the references are there, and I know Kelly said you were gonna send that out. So I do want to say it's interesting that kind of like our statistics raise the bar across the board for all of our patients. We also have two other clinics on the island. One is a federally qualified health clinic, and it had been, I think, into the home to an awful lot of our Portuguese speaking patients previously. And interestingly, as we got this project going and we built trust and care in this part of the community, we've had a huge migration from the federally qualified health clinic to here at the hospital. Changing primary care is, I think, it's really interesting how this kind of program has an impact on everybody's care. And it comes back to what I was talking about before, that whether you're pregnant or not, when you show up and speak a different language in another area of the hospital, people are treating everybody the same and much better, more equally. It is really remarkable, that impact. Although, again, we don't have that specific data. I think Claire, who's on the call now, would say that we have just seen a huge migration of patients picking their primary cares at the hospital rather than going to the federally qualified health clinic. So this kind of impact, this kind of work does affect everything we do. And granted, we are a small place, but you can definitely feel it.
And I love how your results showed, and you pointed out how, you raise the bar for everybody. And so everybody benefits from this. This is not about taking care away from one patient population and giving it to the other. It's really about improving it for all. So a couple of comments that I have. One is, so I really appreciate what you showed at the beginning, how you had 18% Hispanic, but then when you looked by language, 22% speak Portuguese. And I think that's such an important point to drive home, that it is equally important to look at language as well, because if you had just gone by your race, ethnicity, it would have looked different. And then Sandy, I also loved what you talked about. I think we often forget about literacy level, and like you said, being able to check that and really making sure. And I don't know if folks know this, I only learned this maybe like 4 years ago. So, but you can in Word check the reading level for any documents that that's a life change. That's been a life changer, especially when I was working more out in the community. So if people don't know how to do that, we're happy to include instructions, but it's a really great tool that you can use for any materials that you're working on.
Thank you. Yeah, that was key. And we still are, it's a work in progress for what we hand out to our patients, that still, even in, discharge instructions that are still English only, and then they're, hopefully going home and translating them. We go over them with them, but still, that is definitely a work in progress.
Absolutely. I also think it'll be interesting to see your C-section rates, right? Because now if people are coming in their first pregnancy and not having a C-section, right? If they come back to have, you may actually see over time that does become statistically significant.
Yeah.
Right.
Yeah. Interestingly, as we talk as a system on how we address inequities in cesarean delivery rates, we're a place, we have doulas, we have certified nurses. We're in a midwifery-driven practice. I mean, it's really what our patients want, and they do a lot of great work. And yet we have all these great things. Sometimes, I'd say most times, there are 3 nurses taking care of every patient, all the things that you'd want to try to do to decrease your cesarean delivery rate. And yet we still have, this disparity. And I think what it really comes down to is, I think, we also want to make sure that, we're offering everybody the same, kind of induction. The medical care is exactly the same. And it's funny how when we looked across the system, even the large academic medical centers are having the same conversations that we have amongst our midwives and physicians on how we're going to induce somebody and what we're going to do and how we're going to manage that. It is an interesting discussion that is, despite size, all of us have our different ideas about how we're going to do things and what we're comfortable with. I did see the trial of labor question. So thanks, Joyce. But we don't do trials of labor here, though. We've done, plenty of vaginal births after cesarean on patients who show up and, are later in labor. And obviously, we're not going to do that. But we don't plan to do trials of labor here because of our staffing and shared OR space. So.
Other questions for the team? If not, so first of all, thank you so much. This was such an impressive presentation, and thank you so much. It's super inspiring to see your outcomes and also to see just how much you accomplished in a relatively short amount of time. So definitely an inspiration to all of us. So thank you.
Thank you.
Thank you.
Thank you so much.
Want to also shout out to Chelsea Viglas, who has been instrumental in putting the PowerPoint together today with our slides. She came on board late to the group and our committee, and she's been very, very helpful. And thank you, Dan, for your support, and our physicians and our midwives, because people bought into this and we couldn't have done it without them. So thanks for supporting us and what we do every day.
Such a wonderful note to end on, Sandy. Thank you. And thank you, Dan. Thank you to the entire Martha's Vineyard team for your support. You're getting applause from Ron Iverson, and I'm sure from everyone else on the call. Thank you, everyone, for tuning in. Our next webinar is April 16th at 12 p.m., and we'll have the Mount Auburn team presenting. So we hope to see all of you then, and all the best to you.
Thank you.
Yeah, Allison says, amazing work. And yes, reminder, we'll be posting the recording of this session and the slides to our website, and feel free to reach out to PNQIN with any questions.
Thank you.
Thanks, everybody.
Thank you.